Our childhood immunizations are life-saving. They make a profound difference in the health of all Americans. It is really a tragedy that we see so many of these illnesses that are running relatively poorly controlled or unchecked in other parts of the world. And yet here in the United States, over the past decades, we've done a pretty good job of tapping down some of these very dangerous diseases. But we can't forget that they are still out there.
Dr. Bruce Vanderhoff with the Ohio Department of Health is relaying what the CDC has been trying to push for years. Ohio's top doctor says getting your children vaccinated is important, but there's been a recent decrease in the amount of children getting their shots.
This decline is alarming, especially given now that we've seen multiple serious outbreaks in the country in recent years. Obviously, there's one ongoing now, centered in Texas and New Mexico, but not exclusive to those states. And the outbreak has sickened now more than 300 people. We have not had a case in Ohio this year, but in late 2022, we had an outbreak which involved 85 cases, all in central Ohio. Of those 85, 36 required hospitalization.
According to the Ohio Department of Health, there's already been one confirmed death from the measles outbreak nationwide, the first one since 2015.
The downward trend has continued. Our 24-25 school vaccination rates now show that the percentage of kindergartners who are up to date on all recommended vaccines is 85.4%. That's down from 86.2% in the previous year. And the percentage of students who were up to date on measles, mumps, and rubella vaccine, called MMR, fell from 89.2% in the 23-24 school year to 88.3% in this most recent school year. Compare that to the 2019-2020 school year, when the state's MMR vaccination rate was 92.5%.
The measles outbreak is currently centered in Texas and New Mexico. The last time Ohio saw a measles outbreak was in 2022, when 85 people were confirmed to have the illness.
And importantly, out of the 85 cases, 94% were unvaccinated.
Dr. Bruce Vanderhoff says when it comes to vaccinations, measles is just one of the many with an available shot. He says the flu, RSV, and COVID-19 can all be deadly without the proper precautions, and this includes getting your shots. The measles outbreak, he says, is the most dangerous because you don't need direct contact to be infected. Being in the same room as a sick person or coming relatively near them could get you sick as well. In the newsroom, Angie Rodriguez, 19 News.